Have you ever observed an elderly loved one continually scratching specific areas of their body and assumed it was just dry skin or a harmless habit? What if I revealed that those seemingly innocuous itches might be hinting at something much more significant regarding their health? Is there something that might even reduce their lifespan? It's tempting to dismiss these subtle indicators as mere facets of growing older, yet the reality is that overlooking them might lead to significant consequences. Delaying action on these matters can complicate the treatment of underlying health issues that might have been identified and managed sooner. In this video, we will explore 5 particular areas on the body where persistent itching in older adults may act as a concerning signal, indicating possible health issues that could be more serious than you realize. Symptoms ranging from poor circulation to potential heart or kidney problems frequently go unnoticed by caregivers and family members, despite the possibility that they may signal a serious condition. I will clarify the significance of these itches and demonstrate how recognizing them early can greatly enhance your loved one's quality of life. However, this is the crucial aspect. By the conclusion of this video, you'll grasp the importance of these 5 itchy areas and discover effective steps you can take right away to assist your elderly loved ones. I will lead you through identifying initial indicators that may suggest significant cardiovascular issues, nerve impairment, or potential kidney complications. These are all health concerns that, if overlooked, could result in serious repercussions. Timely identification and proactive measures are essential for enhancing their health and overall quality of life. Regardless of whether you are a caregiver, a family member, or simply someone eager to be equipped to identify these warning signs, I invite you to remain with me until the conclusion. Recognizing these nuanced yet impactful health signals will enhance your ability to support the elderly in your life, resulting in improved treatments, timely interventions, and ultimately, healthier and longer lives for those you care about. This video holds essential insights that could transform the lives of those you cherish the most. Let's delve into these 5 essential areas to gain insight into the well-being of our elderly loved ones. You definitely won't want to overlook this opportunity. If you haven't subscribed yet, I strongly encourage you to click that subscribe button and turn on the notification bell to ensure you stay updated with all future videos. Your encouragement is truly appreciated, and if this video resonated with you, consider liking and sharing it to help disseminate valuable insights to a wider audience. If this topic strikes a chord with you, feel free to drop a 1 in the comments below. If you believe there's an area where I can enhance my work, please leave a comment. Your feedback is invaluable in helping me produce content that is both useful and pertinent to your needs. Let's dive in and begin. 1. Calves and soles. Itching in the lower legs and feet, particularly when it lingers, might initially appear to be a trivial annoyance. However, for older adults, it can signal something much more significant than mere dry skin. When this feeling persists, it's more than just bothersome. It could be a plea from the body, indicating that circulation may be compromised. With the passage of time, the efficiency of the body's circulatory system may decline, leading to a notable reduction in blood flow to the extremities, especially in the legs and feet. This decrease in circulation goes beyond mere discomfort. It has the potential to result in numerous health issues that, if not properly managed, could develop into more serious, life-changing conditions. The unease we experience today may serve as a preliminary alert for possible complications such as obstructed blood vessels or heart disease, ailments that frequently remain undetected until they escalate into more significant concerns. For those with pre-existing health issues, like diabetes or hypertension, the dangers linked to inadequate circulation are significantly heightened. Diabetes, for instance, can cause significant damage to the nerves and blood vessels, resulting in an uncomfortable itchiness of the skin, whereas hypertension can exert pressure on the arteries, complicating the flow of blood to the extremities from the outset. These conditions create more than just a nuisance. Such situations can result in distressing and possibly hazardous consequences. Ignoring the signs of poor circulation, like persistent itching, may ultimately result in significant cardiovascular problems. The situation may deteriorate with the emergence of conditions such as deep vein thrombosis, DVT, or varicose veins, which could not only present visible symptoms but also result in long-term complications if not addressed promptly. When an elderly loved one starts to express concerns about persistent itching in their lower legs or feet, it's crucial to take it seriously and not brush it off as merely a benign indication of dry skin. This might be an indication from their body that there is a more profound issue at play. As caregivers, we must view this itching as a possible alert, something that deserves our attention. Recognizing it for what it genuinely represents, a sign of potential circulation issues, allows us to take timely and proactive steps to tackle the problem. Enhancing circulation, modifying medications, or controlling blood pressure are essential measures that can alleviate discomfort and avert the situation from worsening significantly. What may appear as minor symptoms can significantly affect a person's overall health, particularly as they grow older. Delaying action only heightens the chances of facing permanent complications. Pay attention to the subtle signs, such as persistent itching in the legs and feet, and act quickly, as addressing this early can significantly impact your loved one's well-being. Address the discomfort before it lingers. The health of our elderly loved ones is never merely a trivial concern. 2. The nape of the neck. The sensation of itching at the back of the neck transcends mere irritation, particularly for the elderly. What may initially appear as a minor annoyance, persistent itching in this area can serve as a crucial indicator that a more significant issue may be developing beneath the surface. With the passage of time, our bodies undergo inevitable transformations, and the spine is certainly not immune to this process. As time passes, it may start to reveal the effects of prolonged use, potentially appearing as arthritis or various spinal issues. Such circumstances may create undue strain on the nerves traversing the neck, resulting in discomfort. What might first appear as a mere itch could actually be a nuanced yet significant indication from the body that there is something more profound at play. For older individuals, it is essential to pay attention to these signals, particularly when the itching accompanies other symptoms such as headaches, trouble turning the head, or unusual sensations like tingling or numbness. These may indicate nerve compression or, more seriously, a pinched nerve, which happens when the discs in the spine deteriorate or when bone spurs form, leading to excessive pressure on the nerves that extend outward. The resulting discomfort can vary from a slight tingling and itching to more severe pain, weakness, and a myriad of other distressing sensations that can disrupt everyday activities. If someone you care about has experienced neck pain or arthritis in the past, this kind of itching could suggest that the issue is escalating and needs prompt care. It's crucial to pay attention to this matter, as inaction may result in the condition worsening and potentially causing lasting issues such as chronic pain, reduced mobility, or even irreversible nerve damage. It's crucial to recognize the significance of these matters, regardless of how trivial they might appear initially. Frequently, when symptoms become difficult to overlook, the root problem has already intensified. If you're still engaged with this video and appreciate these lessons, I would love for you to drop a comment below to show me you're still with me. If you observe that your elderly loved one is experiencing ongoing itching at the back of their neck, along with any of the other symptoms mentioned, I highly recommend seeking medical attention promptly. Receiving an early diagnosis and intervention can significantly impact pain relief and help prevent additional damage. It not only aids in regaining comfort and mobility, but it also safeguards quality of life, a goal we should all aim to uphold as we grow older. 3. Chest and upper body. If your elderly loved one is dealing with ongoing itching in their chest or upper torso, it's crucial to take it seriously and not dismiss it as merely a minor skin issue. What might appear to be merely dry skin or an irritation from clothing could actually serve as a crucial indicator of underlying issues within the body. A matter that, if left unattended, may jeopardize their well-being. Itching in these areas may occasionally act as an early warning sign of potential heart or lung issues. An issue that might not show obvious signs right away, yet deserves attention and should not be overlooked. With the passage of time, our bodies experience a variety of transformations, many of which can significantly affect our well-being, especially regarding the heart and lungs. For seniors, particularly those with a background of heart or lung issues, atypical signs such as itching in the chest or upper torso should be taken seriously. It may indicate impaired circulation or potential challenges within the respiratory system. 2 concerns that may present as ongoing itching on the skin above the chest. When the heart fails to pump blood effectively, or the lungs grapple with maintaining adequate oxygen levels, the body can react in surprising manners. A seemingly innocuous itch might actually be your body's subtle signal indicating that something is amiss internally. This symptom deserves careful consideration, particularly for individuals with a history of heart disease, chronic lung conditions, or other circulatory concerns. Alterations in blood circulation, such as an obstructed artery, cardiac conditions, or limited airflow from lung function, may lead to feelings of itchiness. These matters run deeper than mere surface concerns. These could indicate something much more severe, like a cardiovascular incident or respiratory complications. The situation becomes especially troubling if the itching worsens during exercise, moments of stress, or physical effort. Should you observe that your cherished companion experiences increased itching during movement, walking, exercise, or moments of emotional strain, it signals a pressing need for attention. This may indicate underlying problems with their heart or lungs that are being exacerbated during these periods. Experiencing itching alongside symptoms such as chest tightness, shortness of breath, or fatigue may indicate early warning signs of cardiovascular strain or, in the most concerning scenario, a potential heart attack on the horizon. These signs must always be heeded. Seize the moment. It's crucial to respond promptly upon observing these symptoms. Identifying a potential issue early allows for timely evaluation and treatment by a doctor, which can help avert more severe outcomes such as a heart attack, stroke, or respiratory failure. Timely action is crucial for preserving lives. Delaying action could complicate the resolution of the problem as it intensifies. If someone dear to you is dealing with ongoing or mysterious itching in the chest or upper torso, it's important to consult a healthcare professional without delay. This might be a significant warning sign that requires immediate focus, one that could potentially safeguard your loved one's well-being. Take initiative and guarantee that they obtain the attention they rightfully need. Prioritizing caution is essential when considering the well-being of our elderly relatives. 4. Fingers and forearms. With the passage of time, our bodies experience numerous transformations, some of which may be understated but significantly impact our overall well-being. One of the often overlooked yet crucial indicators to pay attention to is ongoing itching in the hands and wrists. Initially, this might appear to be a trivial annoyance, a fleeting itch, but when it persists or becomes bothersome, it's crucial to pay attention to it. The skin on our hands and wrists serves a purpose beyond mere appearance. It is intricately linked to our joints, nerves, and circulatory system. Itching in these regions may signal underlying health concerns that, if ignored, could lead to more serious complications in the future. In older individuals, ongoing itching in the hands and wrists may signal underlying joint or circulatory issues that require attention. It is quite typical for older individuals to experience conditions such as osteoarthritis or rheumatoid arthritis, which lead to inflammation, stiffness, and pain in the joints. These conditions, though prevalent, warrant careful consideration. Reflecting on the frequency with which we engage our hands and wrists to grasp items, secure belongings, type on keyboards, or even execute fundamental activities like fastening a shirt or flipping through the pages of a book, we come to understand the vital role these joints play in preserving our autonomy. When the itching begins to linger in these areas, it may serve as an early indication that there are deeper issues at play. Often, the skin surrounding the hands and wrists can become dry, irritated, and itchy as a result of inflammation in the underlying joints. This reflects the body's response to the strain placed on the joints, serving as an indication that there might be an underlying issue. The sensation of itching in these regions may be the body's instinctive reaction to inflammation, which extends to the nearby tissues, encompassing the skin. It's simple to dismiss the discomfort as just dry skin or the weather's influence, yet it's crucial to acknowledge that ongoing itching may indicate more significant concerns. The annoyance runs deeper than mere appearances. This may indicate ongoing inflammation that, if left unchecked, can progressively damage the joints and surrounding tissues, exacerbating the situation and possibly resulting in greater restrictions on movement and autonomy. This unease becomes particularly troubling when the itching intensifies during everyday tasks. Actions we engage in effortlessly, such as holding items, typing away, or even tackling straightforward tasks like fastening buttons on our clothing. Should the itching become more pronounced during these times, it may suggest that the joints are having difficulty fulfilling their roles as they previously did. For older adults, losing the ability to carry out these daily activities can feel like a profound setback, and the emotional toll can be as substantial as the physical pain. The feeling of self-sufficiency and freedom we experience when we manage our own needs is profoundly significant, and when that capability begins to diminish, it can have a considerable impact on our mental and emotional well-being. Yet, the unease extends beyond just joint pain. Ongoing itching in the hands and wrists may indicate circulatory problems, particularly when paired with sensations of numbness, coldness, or an overall absence of warmth in the hands. When circulation fails to operate properly, it can hinder blood flow to the extremities, leading the skin to respond with symptoms such as itching or irritation. Often, inadequate circulation can quietly escalate into a more serious issue, particularly among older adults who might already be dealing with additional health challenges such as hypertension or diabetes. Both of these conditions can greatly impact circulation and, consequently, worsen the symptoms associated with inadequate blood flow. The interplay of inadequate blood flow and joint swelling can lead to a challenging scenario, rendering even the most basic activities more arduous and uncomfortable. Should you observe that the itching in your hands or wrists is paired with additional symptoms like swelling, redness, or joint pain, it is essential to take it seriously rather than assuming it will resolve itself. Addressing these symptoms promptly is crucial for a better outcome. If not addressed, issues such as arthritis or circulatory problems may escalate, possibly resulting in increased joint damage, heightened pain, and a diminished quality of life. Taking action early can greatly impact the management of symptoms, alleviate pain, and enhance mobility, ultimately supporting the goal of preserving independence for as long as feasible. It's important to understand that these seemingly minor symptoms, ongoing itching, discomfort, numbness, or tingling, should not be dismissed as mere annoyances. These may indicate more significant health concerns that warrant consideration. A comprehensive medical assessment, featuring examinations to investigate issues such as arthritis, nerve tension, or circulatory concerns, can assist in uncovering the underlying cause of the symptoms and inform suitable treatment options. In numerous instances, prompt identification and intervention can result in considerable enhancements in handling the condition and minimizing the lasting impacts. For those with cherished individuals facing these symptoms, taking initiative is crucial. Urge them to consult a medical professional instead of hoping the issue will resolve itself. Growing older doesn't necessarily entail losing autonomy or enduring persistent unease. By providing the appropriate care and focus, numerous challenges linked to aging, such as joint difficulties and circulatory concerns, can be handled successfully, resulting in an improved quality of life. If you or someone you know is dealing with ongoing itching in the hands or wrists, particularly when it starts to disrupt daily life, it's important to seek help without delay. Reach out to a healthcare professional who can assist in uncovering the source of the discomfort and provide remedies to alleviate the symptoms. Keep in mind that prompt intervention is crucial for enhancing mobility, alleviating discomfort, and maintaining the capacity to fully embrace life. Don't allow something as minor as an itch to escalate into a more significant issue. Addressing these minor concerns at this stage can avert larger complications down the line, fostering a healthier and more comfortable future for all parties concerned. 5. Itching in the lower back or hips may appear to be a bothersome yet fairly innocuous feeling. A fleeting thought we might linger on for a moment before continuing with our day. However, for older individuals, this seemingly trivial annoyance might indicate a much more significant issue. An issue that requires our focus and nurturing. Frequently, We overlook these minor irritations, brushing them off as mere fleeting annoyances. However, they may occasionally serve as initial indicators that there is an issue within the body. There are aspects that often remain hidden beneath the surface. For older adults, ongoing itching, especially in the lower back and hip regions, warrants attention. This may signal a problem with kidney function, a situation that, if not addressed, can deteriorate quickly and lead to serious damage to the body. The kidneys, frequently overlooked, play an essential role in sustaining our well-being. These organs play a crucial role in purifying our bloodstream, preventing the accumulation of harmful toxins and excess fluids within our bodies. As the kidneys start to falter in their essential role of waste filtration, the body responds in a multitude of ways, some of which may catch one off guard. The body can react in quite a concerning manner, often leading to an itchiness of the skin, particularly in regions such as the lower back and hips. With the decline in kidney function, the organ's capacity to eliminate toxins decreases. The accumulation of these toxins in the bloodstream can lead to skin irritation, resulting in dryness, redness, inflammation, and persistent itching. This irritation can evolve into an unyielding, exasperating feeling, leaving those affected frequently struggling to discover any respite, no matter how hard they try. Kidney dysfunction often presents with subtle signs that can easily be missed, with itching being one of the earliest and least acknowledged symptoms. Numerous individuals may consider it merely a case of dry skin, particularly as we grow older. For individuals with pre-existing conditions such as diabetes, high blood pressure, or a history of kidney disease, this itching may serve as an early sign that the kidneys are having difficulty fulfilling their essential functions. For older adults facing these chronic conditions, the likelihood of kidney dysfunction increases. It's truly disheartening to consider that something as minor as an itch might serve as the body's signal urging us to act before the situation escalates. Neglecting kidney dysfunction can ultimately result in kidney failure, a serious condition that profoundly affects an individual's quality of life, often necessitating dialysis or a kidney transplant. The skin, being the body's largest organ, frequently acts as a quiet communicator. It often reveals the initial indicators of an issue within, even prior to any visible symptoms manifesting in the internal organs. The skin often reacts in the lower back and hips due to their proximity to the kidneys. When the kidneys lose their ability to efficiently filter waste, these regions frequently become the first to reveal the impact of toxins and impurities. Should you or someone close to you experience ongoing itching in these regions, especially when accompanied by additional symptoms such as fatigue, leg swelling, or alterations in urine output, it may indicate that a more serious issue is developing beneath the surface. Seek medical advice before the situation escalates. Timely action is crucial in averting additional issues and guaranteeing that the kidneys receive treatment before their functionality deteriorates beyond recovery. If you're still engaged with this video and appreciate the lessons, I'd love for you to leave a comment below to show me you're still with me. Besides kidney dysfunction, various other conditions may lead to ongoing itching in the lower back and hip regions. A frequent cause is related to nerve issues, typically stemming from pressure on the spinal cord. Issues with the spine, including herniated discs, spinal stenosis, or degenerative disc disease, can put pressure on nerves, resulting in pain and strange feelings in the lower back, hips, and legs. This tension may lead to sensations such as itching, tingling, numbness, or even acute pain. Nerve issues can occasionally present a greater challenge in identification, as the sensation may not resemble a typical itch. It may present itself as a fiery sensation, an unsettling crawling beneath the skin, or an awareness of prickling sensations. If you or a loved one has faced challenges such as loss of balance, trouble walking, or numbness in the lower body, it may be due to nerve compression. Regrettably, older individuals are especially vulnerable to spinal problems as a result of the natural aging process, which can result in spinal deterioration and subsequent nerve compression. For seniors with restricted movement, such challenges may remain undetected for extended durations. If an individual finds it challenging to access or relieve tension in areas such as the lower back or hips, they might struggle to ease their own discomfort. This can exacerbate the issue, as the scratching and itching may persist without being recognized or addressed. Furthermore, certain older adults might struggle to articulate or convey their discomfort, particularly when it comes to sensations that are challenging to describe, such as tingling or numbness. It is essential for caregivers, family members, and friends to remain vigilant and look for any indications of ongoing itching or discomfort in these regions. The struggle to manage ongoing itching or discomfort can significantly affect the emotional and physical well-being of older adults. If these matters are not addressed, the repercussions could be significant. Persistent nerve compression can cause irreversible nerve injury, potentially leading to weakness, diminished sensation, and impaired mobility in the impacted regions. Similarly, if kidney dysfunction is left untreated, it can advance to kidney failure, potentially necessitating dialysis or a transplant. The burden, both physically and emotionally, can weigh heavily on the individual and their cherished ones. Witnessing a loved one in pain or unease, particularly when they can't articulate their struggles, often leaves us feeling powerless. However, this is the point at which taking initiative, being attentive, and showing understanding can create a significant impact. Should you observe your loved one frequently scratching their lower back or hips, it's an issue that warrants attention. Don't delay in seeking medical attention. Address the itching before it escalates or additional symptoms arise. Identifying issues such as kidney dysfunction or nerve compression at an early stage can pave the way for effective treatment. This approach not only alleviates the itching but also tackles the underlying cause, which may help avert serious complications down the line. Consult with a healthcare expert who can identify the root cause of the itching and suggest suitable treatments or interventions. Addressing issues promptly, whether through medication for kidney concerns or physical therapy for nerve compression, leads to more favorable outcomes. In the end, the comfort and well-being of your cherished one hold immense value, and identifying problems early can truly change the outcome. Do not underestimate the significance of something that may appear trivial, like itching. It deserves attention beyond being merely a nuisance. This might indicate that a deeper issue is unfolding. By staying alert, taking initiative, and pursuing prompt medical care, you can assist in stopping discomfort from developing into something much more serious. Both you and your partner are entitled to tranquility, assured that any health issues are being handled with attention and promptness. The importance of your role as a caregiver, family member, or friend cannot be overstated. You play a crucial part in safeguarding, supporting, and promoting the well-being of those we cherish. We truly appreciate you dedicating your time to join us in this learning experience today. A wealth of crucial information has been explored, ranging from the nuanced indicators of kidney dysfunction to the effects of nerve complications and their influence on the lower back and hip regions. These are aspects that often go unnoticed, yet recognizing these signs and understanding when to consult a healthcare professional can significantly impact the well-being and comfort of someone dear to us. What insights have you gained today? What caught your attention the most? What insights will you glean from this video to implement in your own life? We eagerly await your insights. We invite you to share your thoughts in the comments below. What is one insight you've gained that you plan to remember moving forward? If you found this video enjoyable, we would love to hear your thoughts in the comments below. Also, remember to like, share, and subscribe to our YouTube channel for more insightful content. Your encouragement is invaluable to us, and we eagerly anticipate sharing more useful advice and perspectives with you. I appreciate your time and attention once more.